Hello, everyone. Thank you for joining us today. I'm Jessica Esterson. I am the project director for Patient Priorities Care at the Yale School of Medicine, and I'm joined here by some of my wonderful colleagues who I will have introduce themselves.
Thanks for tuning in today. My name is Dr. Jennifer Ouellet. I'm a clinician educator and assistant professor at Yale.
My name is Barry Wu. I'm a professor of medicine in the section of geriatrics, and here more as a caregiver.
Hello, I'm Kizzy Hernandez-Bigos. I am a health priorities facilitator and trainer with Patient Priorities Care.
And we all work together on this initiative that's an approach to decision-making in healthcare, as you've heard it called Patient Priorities Care. And this work was started back in 2014 by world-renowned geriatricians, Drs. Mary Tinetti at Yale and Anand Nayak at the University of Texas, Houston. And then over the course of the past 10 years, we have brought in these and other amazing people all over the country to help work on this initiative. And we are here today to talk about National Healthcare Decisions Day. And this day exists to inspire, educate, and empower people to really think about what matters most to them and how their healthcare can help them achieve those things. So often when we talk about healthcare and decisions, we talk about end-of-life decisions, we talk about advanced care planning, but we know that decisions about your health start much earlier than the end of life. And we also know that as we get older, we may acquire more conditions, more clinicians, more healthcare tasks, especially for older adults, which can sometimes bring up more questions than answers, can be difficult, can be burdensome, and it actually may not focus on what matters to the person. So back in 2014, we're wondering, so what's the answer? What is the answer to all these problems? And that's why we developed Patient Priorities Care. And through this approach to decision-making, we help people identify their health priorities, and we prepare clinicians and healthcare teams to engage in decision-making based on those health priorities and what matters to each person. So really, it moves decision-making and conversation. So where you might go to your doctors or nurses now and hear, you need this treatment for this disease, it moves the conversation more to, well, knowing your health conditions, your overall health, and knowing what matters to you, I suggest we try this. And so again, we've been developing, testing, implementing this for 10 years, and now you're going to get to hear from some of the people that have had experience in this in different ways. Kizzy, so you've spent a lot of time working with older adults, helping them identify their health priorities. Can you tell us a little more about what we mean by health priorities?
Yeah, thank you, Jess. Health priorities include the things that matter most to an individual, and they can vary from volunteering to spending time with family to spirituality. Whatever drives them and has the most meaning in their life are the things that we really want to know about, because we've learned that the things that matter most are the things that don't change over time. They really act as this pivotal point in their life that gives a person this guiding force to why they want to be healthy. We call these things values. And when we talk about values, we want to make sure that we always capture these things that matter most, because they're going to help guide how this person chooses to live out their value. So those health and life outcome goals that we want to identify with this individual, they really help us understand not only what has meaning, but what's the activity associated with what is giving them so much meaning in their life. So an example of a life and health outcome goal is, I would like to spend more time playing board games for 2 hours on Sundays with my children. We know that a life and health outcome goal is realistic and specific by really trying to understand the way that it's been acted upon in the past. So we might want to know more about, when was the last time you did this goal? What was the setting involved? Did you have someone else with you? And we try to see if any of those pieces can still be relevant now. But we want to work through a life outcome goal and make sure that it's not only meaningful, but that it's specific and realistic so we can help this person achieve that goal. Another piece to health priorities is also identifying a person's care preferences. It's really important for us to know what a person is able and willing to do for their health care. And knowing these things also helps us potentially identify any trade-offs that they might be facing. So knowing their care preferences, what they're able and willing to do, and what matter most really can help guide the decision-making and tailoring care to help a person do more of what matters. Another example of a health outcome goal is that I would like to be able to attend book club for twice a week. These things that have so much more meaning to people. We might be used to hearing goals of, I want to lose weight, I want to walk more, I want to be in less pain. But what we really want to know is, if you weren't having as much pain, what would you be doing more of? What are those things that you want to work towards once the weight is gone, once you're able to walk more, once you've gained more strength? Those are some of the really pivotal pieces that we need to know in order to tailor our care around these goals that bring so much meaning to a person.
So it's really getting from more just of a broad goal to something really specific, realistic, actionable. Does that feel different to you as a clinician when you have information like that that's specific? Do you get goals that feel unrealistic from people?
That's a great question, Jess. It's tremendously helpful to have a specific and realistic goal outlined when you come to see a health professional. I think personally for me, I can say, I recommended last time that we try physical therapy, or I recommended a new medication for you. And having somebody outline a specific goal that they want to achieve with those things provides me with a way to calibrate success. So the next visit, you come to me and you say, I was able to go to that book club, or, I was able to take a walk with my grandkids. And that allows us to connect our healthcare recommendations and the things that we want to achieve through healthcare and medicine to what you want to achieve through healthcare and medicine. And so it provides us a way to sort of connect those things in a really meaningful way.
That's great. So this also, we talk a lot about goals. We hear a lot about patient-centered care. I would ask you both, Jen and Barry, how is this a shift from usual patient-centered care?
Yeah, it's a huge shift, Jess. And I'll say I remember when I first started practicing with patient priorities care, how it just felt different. The room feels different because you shift away from talking only about health conditions. Of course, we talk about health conditions, but we shift from talking about only health conditions to what do you hope you can achieve with better management of your health conditions. And it shifts the conversation from you need X medication for this medical problem that you have to I want to help you get your mail every day by giving you this medication or this intervention. And so it's a shift in the way that we talk in the room. It's a shift in the way that we think about a person and their health and what they want to achieve. And I'll say, I think for some people that shift occurs more easily than others. But I can say, as my role as an educator, I'll reflect, and I think Barry probably has similar experiences when we teach our trainees this framework of decision making. They'll often comment on, well, why isn't this just the standard of care now? Of course, all medicine should be focused on what matters most to your patients, right? But it is a frame shift from the usual care. I don't know if you have anything to add,
I agree with you, Jen, that it's a total difference in frame shift.
Yeah.
Because when you care for a patient with multiple medical problems, you have to deal with so many different details. What's the latest treatment guidelines? What is the latest diagnosis test? What are medications? Are they going to harm the patient, or are they going to hurt the patient? So there are so many things to be thinking about at the same time. So that's why a framework of changing of what matters most to the patient really puts it in a different context and really helps shape the care of the patient.
Yeah. And it gives us a place to start. I'll add, Barry, that you mentioned, if you have someone coming in with multiple medical problems, they probably have multiple health professionals that they see. They probably have multiple medical visits that they go to and then take many medications for those conditions. And so sometimes it's hard for us to know what is actually getting in the way. It's hard for us to know which of the conditions or which of the medications is most problematic. And so you help us tremendously when you tell us what matters to you, what you want to achieve. It gives us a place to start decision making, really.
It sounds like this really is what we had hoped it would be. It sounds like a partnership. You're really bringing patients, hopefully their family members or caregivers, and their healthcare team together around what matters most. And it sounds helpful for both sides, that it's actually, it's working well. So I think you're hearing a lot about why we think PPC is important. I think it's also key to understand that people want different things from their care. It's not like everyone over 65 or over 80 wants the same things. Maybe they're working towards different things. So it's helpful to have this information. We like to say that people are the experts in what matters to them, but their healthcare team can help them get there once they know what's important to them. And we've seen as patient priorities care has been, it's being implemented nationally, even internationally in practices. And we're really seeing some positive outcomes from this approach to decision-making and care. And I wonder, Jen, if you could talk a little bit about the kinds of things we're seeing when care is aligned around these health priorities.
Sure. I can reflect a little bit on the pilot studies that Dr. Tonetti did here in Connecticut. And impressively, that study, they looked at a primary care practice in Connecticut. They examined the medical records after visits for persons who had done patient priorities care versus those who had not. And they found that care was more linked to what matters most after implementation of patient priorities care. So what does that mean? So in 66% of the visits after patient priorities care, there was documentation of what mattered most to the patient, and care was aligned with that. So practically speaking, it means more of the care you want, less of the care you don't want, and you get all of your clinicians on the same page. That way, everyone understands what you most want to get out of your healthcare because it's documented, it's shared, and communicated. Importantly, follow-up studies have also shown that there is increased use of community services and supportive services to help people get to a place of achieving what they want. So this is things like social work and physical therapy. It provides us with the opportunity to really work within a team of health professionals to help you achieve what you want. So that was the pilot study and some of the subsequent work. We also can reflect on how health professionals feel after learning about and implementing patient priorities care. Some interview-based studies have found that health professionals feel more connected with their patients. They feel that the communication is enhanced. They feel that the relationship is enhanced, and that they have a better way to calibrate the success of what they want to do. So they have a target to focus their care and decision making.
And so some people might be thinking, I've been seeing my doctor or my provider for a long time. Don't they know me already? Don't they know what's important to me? Why would I have this conversation? Can you speak a little to that?
Yeah, I'm laughing because we hear this a lot in our trainings with colleagues and with trainees, and that they're right that they probably do know their patient very well, but unanimously, health professionals and clinicians will reflect after the fact about how much more there is to know about people and their life. And you might know a person and their kids, and that they enjoy gardening on the weekends, or that they make Sunday spaghetti dinner. But you might not know that what brings them the most value is volunteering at a library twice a week. And so what we think comes up naturally in conversation may not. Additionally, I think it provides us with an idea of getting to know what the patient does and doesn't want to do for their healthcare. It provides an active seat at the table for people to tell us the things that they do or don't want to do to achieve the goal that they most want to. And I think sometimes people might hesitate or feel worried to tell health professionals things they don't want to do. So this provides an open conversation.
Kizzy, have you found that also? And you've had some of these conversations?
Yeah, it actually came up quite a bit in the original pilot, which was really exciting. And one of the responses was because the clinician stated, my patient asked me, why are you asking me this? You know me so well. And the response from her colleague was, because we want to know how to best measure the success of what matters most to you. This is why we need to know this, because we want to make sure we have a way to calibrate how you're doing this, how often, and that your life is having all this meaning.
So we want to talk about then, how do people identify their health priorities? We're talking about how important this is. This isn't just sitting down with someone and having someone ask you one question. So one of the most helpful tools and resources that we developed through Patient Priorities Care is a website called myhealthpriorities.org. And it's a free and open access website that, hearing all these things you're talking about, that we developed to try to help people get to these important health priorities. Kizzy, do you want to tell us a little bit more about this website, how it works, and why everyone would benefit from doing this?
It's a wonderful website. It's very user-friendly. It actually takes you through a series of questions that provide you with options that are likely very relevant to the journey that you're on at the moment, because it's very inclusive of this sort of lifespan of what may have meaning to me, what can I relate to. Then it talks about how we want to live out that meaning. And then it takes us to, let's talk about your care. Let's talk about some of the things that you're actively doing for your health. And then let's talk about some of the things that might be a little more difficult on a day-to-day basis. What is considerably taxing for you that you're not even realizing could bring up an opportunity for some changes? And that it's okay to talk about these things, because if they're not helping you do more of what matters to you, let's take a look at it. Let's think about and brainstorm together ways that we can align your care to do more of what matters. And what's wonderful about all of this information that's being gathered through this really intuitive system is then it's actually creating a health summary for you so that you could just print out and in order to share it with your loved ones, to share it with your healthcare team, to share it with your community teams that are also supporting you.
So everyone knows what you're working towards and what really is important to you.
Exactly.
And Barry, I know you went through My Health Priorities with your mom, and I was wondering if you could tell us about that.
Sure. Well, I'm a physician, but I'm also the son of a 90-year-old mother. And when I was in high school, my dad was diagnosed with lung cancer, William. That before he died, he said, be sure you take care of your mom, because she dedicated her life to us and to take care of us. And since after he died, I've called my mom every day at 7 o'clock every night. She lives in a different state. So caring for her really is a burden in my heart. So I have a camera set up and I call her. I visit her 4 times a year. But the thing that I think that helped me the most was 3 years ago, Mary Tonetti asked me to go through mypriorities.org website with her. I said, oh, well, okay, let's try this. So I went through it with her. She had a little bit difficult time with the computer, but as we were going through the material, she says, hey, this is different from my usual care. And what came out was really interesting to me and really changed my perspective. I thought what was important to her were connections with family and, visiting, going to the church and that kind of things. But what came out was function was important to her. As she was getting older, she became more incontinent of urine, and that was a real burden to her. And her function was a big deal. And so that was really important because a year ago, as she was getting older and needing more assistance at home, she's a very private person, trying to get a visiting nurse to come in was difficult. But after going through patient priority care, knowing that function was important to her, that really helped with the conversation. And I will have to tell you, over a year later, she looks forward to the visiting nurse coming. So it was a big change. So in her care, it really was very instrumental in providing her, I would think, the best care.
So even going through that as a geriatrician and knowing her very well, you still learned something.
Yeah, she
really
didn't want to
important.
learn from me the latest research or the data. She wanted to be cared as a person, and we know Francis Wield Peabody said the secret of the care of a patient is caring for the patient. And in order to care for the patient, you need to listen to what's important to them. There is so much data, information to keep track of. And it's really important to listen. One of my teachers always said, well, Barry, why did God give you 2 ears and 1 mouth? It really is to be able to listen to people, but you have to be asking the right question.
And that's exactly what we're hoping that My Health Priorities does for people, because it gets to important information like this, these specific, actionable, realistic goals that people can very clearly share, right, with their clinicians, their families. So it sounds like that was a really positive experience.
It was.
And did it change your perspective as a clinician?
Yeah, I would say, I've thankfully been practicing medicine for over 30 years. And I would have to say this has changed my practice of medicine because in each patient I see, one of the most important questions I ask them is, what's most important to you? And when people come to the hospital, it's really important. What do you want to get out of being in the hospital? What is the one thing that you want to is your goal? And really helpful for me as a physician to know what's important to them and to focus on that.
And Jen, how has you're involved as a clinician doing patient priorities care? You are also teaching patient priorities care. So what are you finding as you're sharing this with people that are becoming the next generation of clinicians and doing this?
That's a great question, Jess. I'll say that's one of my favorite parts of my job actually is teaching this to trainees and other health professionals, because you see these like aha moments where medical students and PA students, nursing students are like, of course we should practice this way. Of course I want to get to know my patients better and know how to help them achieve what matters to them. And what I love about patient priorities care is that it allows us a way to systematically go through what matters most, how to align care with that. And so using some of the tools like the website, like some of the other things on the Patient Priorities Care website, we provide tools to the next generation of health professionals to be able to do this in a systematic way. And I'll say we've used many of the tools, including the mypriorities.org website, and trainees used it actually. So we've had our fellows use it in their clinic. So they've gone through it in real time with patients. It's not just something that people do at home, at their house on their computer. So we've had our fellows go through the website with patients. I've used the website with patients. And I've actually had some of the residents reach out to say that they went through the process after learning about patient priorities care. And so I think, it's been tremendously impactful to be able to share this with the next generation of health professionals. And I think they find it really inspirational. I mean, when Barry and I teach with the medical students and, after each session, we hear really wonderful, heartwarming stories, not just about how people want to take this to their patients, but how they want to take it to their families, right? So trainees will say, I want to use this with my family. I want to get to know what matters most to them so that in the event of a medical illness or a change in health or a change in life, frankly, you know what matters most. So bring it home for Thanksgiving, go through, have your turkey dinner and go through your website. But it's been really fun to see, the next generation gravitate towards this information.
And these,
I just want to add, I
Yeah.
really think it is the state-of-the-art care. And I would say 3 weeks ago, the graduating class at Yale School of Medicine, the class of 2024, was trained in this by Dr. Mary Tanetti. And so it is training the next generation of physicians.
and then we're training other Mary Tinettis all over the
Yes.
country, we hope,
Yes.
better than bringing it to their places and their students as well, and preparing that next generation. So it's really remarkable how it is spreading. It's also, I know you've heard us talk a lot about that this is especially helpful for older adults, as we've said, more conditions, more decisions, everything. But really, this type of care is appropriate for everyone, anywhere in the lifespan. Would you agree?
Absolutely. I'll say, even if you're thinking to yourself, my health is good. My health is relatively good. I'm able to do the things I want to do in my life. It's helpful to do this process and to have these conversations so that in the event of a change, you know what matters most to you. It provides you and your family a way to start that conversation, maybe even before you need it.
Yeah. And it sounds like this is also, we found that it's a way to sort of practice having these conversations. If you start having conversations about what matters or being really transparent with your clinicians, with your family, and you start doing that as your health may change or your life may change, you can have those even harder conversations.
Exactly.
So any closing thoughts, anything that we didn't get to about patient priorities care that we want to say?
I would recommend checking out Patient Priority Care website. And I think it's great because, the person is taking an active role in their health care. They're not being told what to do. You're participating in your own health care. And that really should be a joint thing.
Yeah, so we really do. We hope, as we've said, everyone should be identifying what matters most to them so you can share it with whoever is important in your life and your health to share that information with. We hope everyone takes a look at My Health Priorities, really think about what's important to you, and then you'll have this summary that you can bring with you to all your visits. Your family may learn something about you they don't know. Your clinicians may learn something about you they don't know and that they can help you with. Thank you so much, Kizzy, Barry, Jen, for being here to talk about this important work and decision-making and care, and for helping us share this information.